see your faces. It is 10:01, so we're going to go ahead and get started. Thank you guys all for joining us. And we have some good updates for you today. I'm going to apologize in advance. I have to jump off the call at 10:30, and I know a couple other Partner for Work folks have other meetings and things as well that they have to jump onto. Kristen Kramer is one of those folks. She's our Senior Director of Fiscal. So if anybody has fiscal questions, then feel free to drop them in the chat now. If you're
I didn't click in and say I'm here.
Hey, Kathy, we hear you.
Oh, okay.
So then we'll, you can drop any fiscal questions in the chat, or feel free to kind of pipe up if you're on the phone and you're not on chat, and we can throw it over to Kristen a little early. So again, thank you all for all that you're doing, and I hope that you are all taking care of yourselves as you take care of others. And wanting to just get right into it, I'm going to throw things over to our Director of Policy, Dylan Moore. We have some updates for you all on the oddly named Pandemic Unemployment Assistance, PUA program, and some updates from our partners over at the Unemployment Compensation Office. I will, before Dylan jumps in, just reiterate that the UC office is working as diligently as they can to get unemployment claims processed and people paid as quickly as they possibly can. One thing that's incredibly important if you're helping clients fill out UC claims at all is to make sure that they do it correctly. And by that I mean making sure they're spelling their name correctly, making sure they're putting in their social security number correctly. Those claims that are filled out correctly the first time are sailing through pretty quickly. It's when the UC staff have to go in and correct anything that's been mistakenly keyed in by the person filing for those claims that they're taking a little bit longer. And of course, folks are frustrated with that. So that's one thing to note. And the other thing to make sure that everyone knows is that obviously we're kind of tracking the UC claims nationally, and Pennsylvania continues to be at the top of that list. I think we're at 26 million claims in the United States as a whole, and quite a few of those are coming from the Commonwealth, more than almost 1.5 million, I think, at this point. So there's a quick question that I'll get to right now before I turn it over to Dylan about Learn and Earn funding. So to our knowledge, Learn and Earn, all the money that we've raised to date is in hand. So that's city funding, it's county funding, it's our funding, it's some foundation funding, and that goes for any funding that's currently into a contract right now for us. And the state has put a hold on discretionary funding, but we're not hearing that any money is currently on the table that we have that would be clawed back. So to our knowledge, anything that's already been awarded to us and that we have a notice of obligation for is in hand, and you can kind of start to plan around that. So absolutely, there are going to be significant budget issues across the country, across the world as a result of this crisis. If anyone was on the DHS provider call, you heard from Mark Cherna yesterday talking about the fact that there is a $5 billion budget deficit in Pennsylvania over the next year or so as a result of this crisis so far. So we know it's going to have lasting implications down the line. We just don't know quite what that is yet, but summer right now seems to be okay. So we'll keep you posted if any of that changes. And I will turn it over to Dylan. And Dylan, while you start talking, I'll pull up your slides.
Great, thanks Susie, and thanks everybody for being on the call with us today. So yeah, Susie's just pulling up the slides. We wanted to take a sort of deeper dive into this pandemic unemployment assistance program. So if you can just go to the next slide, Susie. So last Friday on April 17th, the Governor Wolf announced the launch of the state system for processing these pandemic unemployment assistance claims. And just as a refresher, this is the program that was set up through the CARES Act legislation from last month that creates unemployment benefits for individuals who previously would not have qualified for a regular unemployment compensation program. So the list below shows individuals that have lost income during the COVID-19 crisis who were self-employed, were independent contractors, people working in the gig economy. It also extends benefits to workers in religious organizations. And then also people that may not have a full work history to qualify for unemployment compensation. So as an example, and this has actually came up a couple times, we've received some questions around this, but people who may have received a job offer that was supposed to start in the next month or next couple of months, or a summer internship experience and those types of things that may have been rescinded or postponed due to the COVID-19 crisis, may be able to access benefits through this pandemic unemployment assistance program. So, and you can go to the next slide, Susie. So just as a refresher, we talked about this a little bit, I think, last week or the week before, but so the benefits program provides access to unemployment for up to 39 weeks. In the state of Pennsylvania, individuals through the PUA program can receive the maximum benefit rate allowed in the Commonwealth. So that is currently set at $572 per week. And the minimum amount that individuals can receive through this program is set at half of what the average weekly benefit amount is for people receiving unemployment across the Commonwealth. So that current average weekly amount is $195. So half of that would be $97.50. So the payment program, and this is written into the CARES Act legislation, allows individuals to qualify for payments backdated to January 27th or to the first week that an individual became unemployed or lost income. So whatever that later date is when individuals would be able to begin to start qualifying for payments. And as of now, this extension to these self-employed and gig workers and contractor, this program is temporary. So it is set to expire at the end of this year on December 31st. But these individuals who are able to qualify through the PUA program will also be able to receive that additional $600 per week that was written into the CARES Act legislation. And just to clarify, this $600 per week addition is only set up through July 25th, 2020. And if we can go to the next slide. So this slide shows some of the documentation that individuals will be required to provide during the application process for PUA benefits. So, so the first bullet point here, so individuals will have to provide some type of verification or documentation that they lost income or are unemployed due to a COVID-19 related reason. And this is just a couple of examples of acceptable documentation. So things like documentation from medical professionals that show that an individual may have contracted COVID-19 or someone in the household may have contracted COVID-19, which prevented them from being able to work. Things like documents from schools or child care providers if individuals were required to stay home to care for a child due to closures, documentation from employers, or if individuals are self-employed and they can provide, notice that, from state or county government that the stay-at-home order has forced their business to close down due to not being non-essential or non-life-sustaining. That could be a type of documentation that could be provided for this program. People will also have to provide a proof of employment or self-employment. So those are things like paychecks. If they're self-employed, items like a business license or some type of proof of operating a business. And then also providing proof of past income so that the program can set up the amount that an individual is eligible to receive. So those are things like pay stubs or tax returns. For self-employed individuals or independent contractors, that might be a contract to show contracted amount that they're eligible to receive, or some types of invoices with the entity that they're contracting with. And next slide. So just to offer a little bit more clarification, and this is something that came up on the call that Susie and I were on earlier this week with the Department of Labor and Industry, but individuals should not submit applications for the PUA program if they are already receiving or if they would qualify for regular unemployment compensation. So, representatives from UC were very clear that, individuals can't double dip into the benefits program. So if they're already receiving regular unemployment compensation, they would not be eligible for the PUA program. And as another clarification, individuals, if they are still working full-time, but maybe saw a loss of income from another part-time position, they would not be eligible to receive PUA due to still working full-time. So an example that I put on this slide, if John still works full-time at PNC Bank, but he had a part-time gig with Uber and saw a reduction in hours or compensation with the Uber gig, he still would not be eligible to qualify for the PUA benefits because he's still working full-time with PNC. And that was a clarification that was provided to us from UC staff earlier this week. And then the slide also just has links to the application page for individuals who want to submit a claim for the PUA program. And then the state has also set up a FAQ section that provides a lot of pretty helpful information and clarifications regarding the process for accessing these benefits. But yeah, that's all for me on the PUA stuff.
Thanks, Dylan. We will, as always, share these slides out so you'll have those links. I just want to, I'm going to stop sharing so I can see the chat, but are there any questions that anyone has on unemployment compensation, on the process? Has anyone, we're hearing that folks are getting through the process. A lot of calls is being worked through and emails is being worked through, but there's certainly still frustration from folks who are having trouble. So if you're hearing that from any of your clients that you're working with, please do let us know, and we'll continue to filter that back up to the state. One other, go ahead, Dylan.
Yeah, I was just I meant to add this. So a pretty important point right now is that the system that has been set up for the PUA program is currently only an application only. So basically the system's been set up so people can begin to submit their applications, but the state made it pretty clear on the call we were on earlier this week that they're still setting up the full functionality. So things like the functionality for determining eligibility for processing payments is still in the works. So payments likely will still be a little bit delayed for the PUA program as opposed to the regular unemployment compensation system.
The other thing that the state wanted to make clear too is that people should not double dip, like Dylan said, and that is both for the PUA program as well as the unemployment compensation general program, but it's also if a company applies for the Paycheck Protection Act and brings its employees back on to pay them while we're in this pandemic, then the individuals should not be applying for unemployment compensation while they're getting paid by their company. And that's a little bit dicey in some situations because the company might have applied, but we just don't know whether or not they have gotten it yet. So the good rule of thumb is to say, if someone is currently receiving a paycheck, they should not file for unemployment compensation for those weeks. So if there's any questions on that, the UC office is really the right place to send people, and we're not equipped to necessarily answer specific questions on claims or that process. Okay, so Sarah, we'll filter that information up. Sarah put in the chat that people are having difficulty getting through to the UC staff and that they need to turn in more information, but there's a lack of guidance on how that's done. So we'll make sure that we filter that feedback back up to the state. All right, any other UC questions or policy questions for Dylan? There's another stimulus package in the works, so we'll have an update for you on what that contains related to workforce next week. Most of it, the lion's share of it, is for Paycheck Protection Act, since that money went quickly. And also there's some in there for hospitals, and I think for schools for some technology resources as well. So we'll take a look at that and then get you some feedback on it next week. So with that, I will turn it over to our Director of Adult Programs, Andy Smith.
Hey, everybody. I don't have too much to share with you today. For our programming on the adult side in the Career Link centers and with our Earn and Work Ready programming, we're kind of hard at work on strengthening remote delivery service options, but also looking toward reopening, although we don't have dates for that or know of even potential dates for that. And I think we're going to talk a bit more about it today, so I'll leave that to others. But I did want to highlight one resource, and I can't remember if we talked about this in our last provider call. But you know, as people go onto the CareerLink site and they look for jobs, one common complaint, and I think a fair complaint, is that the volume of postings and sometimes the effective dates of postings make it really difficult to navigate. So in response to that, one thing the state has done that we're trying to promote is create a separate page for what they consider to be like COVID-19 related or hot jobs. These are jobs that they're trying to promote that have at least, these are employers with at least 10 or more openings who the state has verified are in this kind of operational space where they're allowed to post these jobs according to the governor's employer list. And so it's very easy to access. You just go to the CareerLink website, and from there, there is a banner that you can select pretty close to the top of the page. And when you click that, it'll take you straight to this new webpage where those jobs are being featured. I think they're still working on it, trying to make it a little bit more searchable and a little bit more navigable as they've worked with employers to get these jobs up on this site. You know, there's been a lot added. And I think as the volume increases, it's getting a little bit difficult to find what you want here, but there's still a lot of good job leads and postings that we know are active. So the way that's being done, employers are being encouraged to fill out a web form. And Susie, if you scroll to the top of the page, thank you, you'll see what that form looks like. This form can be filled out by the employer directly, or it can be filled out by one of our business service team members on behalf of the employer. And what happens is when an employer fills this out, someone at the state is just taking a quick look at it to make sure that everything is valid. And once they determine that it's appropriate to post the job opportunities, they go straight onto that website. So I think that's pretty straightforward, but let me pause and see if there are any questions on that.
I can't see this chat when I'm sharing my screen, so somebody else will have to monitor that. A couple of things while you're doing that. One is that the state is building the resource or the functionality to be able to search these jobs. It's just they wanted to get the board up there quickly. But in the interim, if you do a Control F for Allegheny, then hopefully jobs that are in Allegheny should pop up, or Allegheny County or Pittsburgh. It looks like there are 6 different locations specifically in Pittsburgh here, but more are being added as we go.
Yeah, okay.
And if your agency too has 10 or more openings right now, I know some of you are working on developing emergency shelters or building emergency shelters or additional services, and you have service needs, then you are absolutely welcome to go and fill out as an employer that you have 10 or more openings in this location. If you have 10 or fewer openings across your business, then certainly adding those to CWDS is a good idea as well. Anything else, Andy?
No, I mean, as we talk about some of the reopening guidelines that we're working on, I'm glad to add some feedback, regarding things that we're thinking about for CareerLink and for EARN. But I think that's it for me this morning.
Great, thanks, Andy. So I will turn it over to the youth team from Partner for Work. Mayada, Jesse.
Good morning, it's Mayada. I'm gonna kick it over to Jesse though, because he's ready to give you some updates on some things we've been working on that some relate to the youth team, and then some also, I think, relate to our larger provider network. Go ahead, Jesse, you there?
I'm here. Thank you, Mayada. Good morning, everyone. So I just want to provide you some updates of where we are so far regarding a couple of deliverables we're working on. So we've been working with the compliance team, with other leadership across Partner for Work, particularly fiscal, to come up with memos regarding what's allowable for expenditures under TANF and WIOA, and what the outcomes are, where we can be flexible. So that is still forthcoming. That should be available in the coming days. So that is something that I know our network had requested, and we are still working on that. So that is coming in the next few days. So please have some more patience with us. Also, I spoke to, thanks, Tiffany. I spoke to a few of you already, and my staff probably reached out to you regarding post-pandemic planning. What that means and what that will entail is just kind of thinking about what it looks like for your organization's reopening. So, for example, with some of our providers who are in school youth, schools aren't reopening this year. That's the reality of it. So, just taking a look at what your programming will look like if we are able to open up and you're able to reopen your doors for services. But also, we also have got some guidance on the COVID-19 preparedness that was prepared by Kristen Kramer. Thank you very much. It's very, very detailed in terms of what guidance we want you to kind of think about for your organizations for preparedness to deal with COVID-19 once doors do reopen. So some of those guidance items are looking at potential ways staff could potential ways staff could be exposed to COVID-19, special accommodations for staff at high risk of infection, guidance on infection prevention measures, policies and procedures for prompt identification of sick people, workplace flexibilities and protection policies, ensuring response plan understanding compliance, and also internal questions to consider. So all of that information has been gathered, or that guidance has been gathered from the OSHA, current recommendations from OSHA and the CDC. But please feel free, if you do have questions in the meantime, while we're waiting for those documents to come out, please feel free to reach out to me or Mayada or your chief program contact for Partner for Work.
Thanks, Jesse. And that the guidance document that he's referring to is one that I think really is relevant to all of our providers across the board. And so if there are things that you've already been thinking about knowing your operation and, how am I going to do X in a situation where, once humans are free to roam the planet again, this is a good time to raise those things so that we can go back and sort of look to see, what does OSHA say, what does the CDC say, and compile all that information so that as you're thinking and developing your plans, you don't have to recreate nor do you have to go on your own and find some reputable information. We want to make it as easy as possible for you. So if there's anything that you have been thinking about that you think we should look up and make sure is included, please let us know that too.
Thanks, Matta and Jesse. I'm going to jump off the call here, but want to reiterate that we know that a lot of you are already doing some post-pandemic planning, and some of you still are providing essential services. And so you've likely done quite a bit of work on how do we make sure staff are safe? How do we make sure that individuals who are coming into our locations are safe? We don't want you to recreate that. And it's not going to be, you have to create one plan for DHS and one plan for us. We're looking to just make sure that everyone's thinking through all of this stuff, and that you can take portions of the plan that you've already done and just make sure that it's pertinent to workforce. There's a question in the chat real quickly that I'll get to before I jump off, and Andy and Mayada are going to stay on the call, is whether this summer is going to be 100% remote or not for Learn and Earn. Our goal is to do some in-person work sites if we can this summer in a socially responsible and public health responsible fashion. Obviously, if the pandemic shifts in any way, then we're looking to be as nimble as we can. So if we are still under a stay-at-home order in July, then in all likelihood, no, there won't be any in-person work sites. But that's something that we'll kind of cross as we get to it, and we're creating contingency plans around. So again, thank you all so much for all that you do, and I'll leave you with Andy and Mayada. Appreciate you all.
Yeah, so I'd really like to get some feedback from the group along these lines of reopening. And I think we're kind of using this term reopening, understanding that we don't know when this is going to happen. But a lot of people are also using this term post-pandemic, which I think is also a little faulty, right? Because I have no idea when this pandemic will end, and even when we do go about our usual business again, will we have to go back into a stay-at-home pattern? And what will be the criteria for that to happen as well? So we're definitely not, Partner for Work is not, we don't have expertise in this regard. I think we're trying to, as Jesse said and Mayada said, gather enough guidelines to be helpful to our contracted providers, but realizing that you guys either have that expertise yourselves or are connected to other funders, other organizations that have more expertise than we do in that regard. So, for example, the guidance from the Allegheny County Department of Human Services is really great. They have a website set up dedicated to guidelines related to COVID-19 and operating during and after COVID-19 that we definitely promote. But as we collect information, ideas, best practices, etc., and try to sometime soon share them out with our provider network, we want to solicit from you, gather feedback from you about your thinking, your planning, your ideas. So, are there a few folks who could share with us, some of their plans, at least preliminarily right now? I'd very much be interested in hearing good ideas from the group.
Hi, this is Sarah Berg. We're actually starting to research some options for online teaching materials. There are a few companies that actually offer career training kinds of things, where they offer videos and give the participants the opportunity to engage in virtual learning. They actually have those fancy little goggle things that people can actually engage in the activity of whatever the job may require, whether it's building something or they virtually will build if they're studying carpentry. So we've been looking into some of those and see what kinds of opportunities they provide, and also whether it's something that we're going to be able to afford participating in because it is a costly thing. So that's one of the things that we're really looking into as a possibility, even for this summer, for Learn and Earn. And we have already started using some of those similar tools that are available for free, usually through YouTube videos and things like that, that show people how to do certain things. And that seems to be pretty well received. And it seems like people are actually able to participate in that way.
That's helpful. Thank you, Sarah. I think one part of a reopening strategy is we reopen the career links, especially because CareerLink has a strong association with unemployment compensation, even though we're not representatives of that system. One thing that we're thinking about as part of our strategy is, to strengthen the remote engagement, remote service delivery opportunities that participants have, and basically giving people an alternative to coming into our centers to engage in the programming. So that to the extent that we can identify resources like that are strong, because I think there are a lot of resources out there like that, but when you start digging and participating in them, you think, well, this isn't very high quality. So I think like the trick is to identify those things that will actually add value to participants, invest in them, and put them in front of folks who can actually use them as a strategy to, as kind of a social distancing strategy to keep an overwhelming amount of participants from physically coming into our centers. Sarah, we're also engaged in that work. We're creating an online learning management system that will connect to our local CareerLink site. And through that LMS, we'll be hosting recorded workshops from CareerLink, the orientation materials from CareerLink, and we're also working on, which I think will be ready next week, protocols for remote enrollment, which has been tough because, when we conduct an enrollment, we are requesting sensitive documentation and personal information. And we never have been able to do that completely virtually until now. The state is finally allowing us to do it with certain safeguards and precautions, which is kind of another component of remote service delivery, right? But to the extent that we can have a robust remote service delivery model, I think we can, number one, give people that option who otherwise wouldn't be coming into the centers, and number two, kind of actively encourage folks to engage with us in that way rather than coming and getting face-to-face with our staff. So thank you for saying that.
One thing I would like to add, Andy, is one of the things we're finding is that with the being able to register online, I think that's a great resource to have. One of the things that we're finding is that many people do not have the technology available to them. And many times they try to go on their cell phone to try to do some of that work. And if the website isn't cell phone friendly, it becomes very, very difficult for them to try to do anything online. So, if I have a suggestion for any of this, is really to work on making sure that whatever resources are out there, that are the platforms are friendly for those people who don't have a laptop or who don't have a computer, that they may be able to use a mobile device to do that.
Thanks for that, Sarah. I just want to say too, I know that most of us have been, up to our eyeballs in thinking and beyond, thinking, how are we going to do, how are we going to deliver services in this context? And how are we going to switch to our virtual work? And how do we make what we do accessible to the people who need it? And I think all of that is really good work. And I feel really proud, actually, of how much we've been able to collaborate and share when it comes to that kind of thing. I think where I want to offer a friendly push is to think now about that next step where, people are allowed to come back to your facility. And so what does that look like, and what fears would you have? Some maybe are open to, to some degree even now, but, how do you prepare for that moment where you're not sure, for example, if anyone is sick or if they've been sick or how they've been exposed, and how you'd be able to gauge who we should service and who we shouldn't, and what should be our own internal HR policies around sick leave and things like that. Like those are the things that I think are what is also included in this planning for this next normal, I suppose, that is halfway in and out when it comes to this post-pandemic strategies. And so that's where I just kind of want to, maybe that's something that we haven't really thought about yet as a group. It's completely okay to say, you know what, haven't even thought about that, but that's something to think about as we move forward. But I just kind of want to push us to thinking beyond just the service, but then, what are we really going to be able to do, or how can we be helpful in helping you to think through that process and plan for it?
Miranda, this is Jane Lee with Youth Places. I do have some concerning thoughts because we are definitely a in-person service type of thing when we offer students learning opportunities, and we would be doing a summer camp. So I am quite concerned about that. How would that look? Because a virtual summer camp is not really going to work for anyone. Most of the young people now are doing online learning. They are not going to want to do a summer camp via online. And also most of the demographic that we deal with, parents need someone to be able to send something to send their kids to for an in-person type of atmosphere. And it's just concerning to me how we would possibly do something like that because of the cleaning. How do you do social distancing? How do you do all of those things? And I come from a background, excuse me, I'm a scientist, I'm a chemist, so I get a lot of these things. So I often think about the logistics of all of that. Online learning is great, but what do you do when you do open up the economy or services, if you will?
Thank you. That's something we can definitely look to as we develop these this guidance around. Are there things that have been published for daycares that we could adopt or adapt for summer camps to help us think through how to go through those procedures? So I appreciate that you raised that, and we'll definitely make sure that that's something that we look at too and share out.
Thank you.
Sorry. So are we specifically referring to the thing that Governor Wolf talked about last night, like the red phase, yellow phase, green phase? Like in terms of talking about reopening and everything?
I think to some degree, yes, because that yellow phase is where there still would be some limits around social distancing, but we still are able to we're not under a stay-at-home order, and so there's a gray space that has been created by that I think we just need to plan for.
So I guess, would you be anticipating that we will most likely find ourselves in the yellow phase come the like what would be the start of the program this summer?
In terms of a timeline, I don't know if I could really say. I feel pretty confident in my assumption that we would at some point be in the yellow, right? You don't just go from red to green. So I'm not sure when that would be, but I'm hoping, but we don't know for sure yet at this point.
Yeah, I mean, I was looking at the yellow phase, and I know this just came out last night, so there hasn't been a whole lot of time to process it. So like assuming that we are in the yellow phase, I mean, it does still say like schools remain closed for in-person instruction. And
Can I call you back after my meeting?
as the youth places person just mentioned, it does also emphasize necessity of increased like cleaning of spaces and all of that. And yeah, I mean, I definitely have concerns over how we would actually be able to do something like that in person with a bunch of high school students.
Hi, Andy. It's Jen Bozak. Can I chime in a little bit here to talk about what we're doing? Okay, so in terms of Reopening America plan, and much of which the governor spoke to yesterday. We have been planning around incorporating kind of a multi-format program that's phased in according to those phases that some of you have seen last night. We will be staggering staff, for example, rotating staff and rotating clients as well. We have the capability to do that. We will have teams. The way that we're structured might be a little bit differently than anybody else, but we will be implementing pretty much like a team approach where we'll have less than 10 people on site, probably even 5 people on site at a given time, and rotating staff out throughout the week, as well as their caseloads. So their caseloads may be coming in, but we might stagger them even throughout the day, times that they're able to come in. Other things that we might do is the days that they're not scheduled to be in, clients, for example, they'll have the ability to participate remotely. And we're continuing to explore, just like Sarah had mentioned, other types of opportunities for remote work and participation. And this is on behalf of the EARN program. So those are just some quick plans. We are leaning on our HR department, absolutely, for some of the overarching policies around when to report illness, or essentially right now it's you're not coming to work if you are feeling ill. Those that might be test positive with COVID, then we're adhering to the CDC guideline with that, with 14-day quarantine, unless we get better directives.
Thanks, Jen. Yeah, and I totally understand there are going to be those programs where remote service delivery isn't an option at all. Those programs where it's an option for some, but not all folks. And I think reopening, when we think about our physical space, whenever that is and however that looks like, we should all be thinking across a few different areas of preparation, right? There's the building itself, the space that you operate in, and how that may need to be set up, how that may need to be configured, right? And thinking about social distancing. There's your workforce and preparing them, training them for understanding how to interact with people and how to kind of, I think, embrace the guidelines that you set up in terms of your space and how your programming is going to run. There's access to the space to think about with participants, and how they'll be coming to your space and how you want to try and manage that. There's, again, the social distancing plan, I think, the guidelines that you want to put into place there. There's the cleaning part of it. And I think there are a lot of pieces to that. And I think that's going to look way different depending on who you're serving, where you're serving them, what resources you have. We're hearing a lot of different things with the personal protective equipment. Some agencies have that and did have it before all this. Some don't. Some have access to it, to purchase it. Some don't. So I think it's really going to have to be a variable approach to each program with each agency. And I think, understandably, given how big we are and how many what resources we have access to, I think that's going to be difficult for a lot of us, more difficult for some of us, understandably. But I think coming together in this way, sharing ideas, best practices, and resources that folks have available that they can share with others is going to be important. So, are there is there other feedback, ideas that folks want to offer?
I guess another question. So what I'm hearing is that you anticipate that most likely it will be at the discretion of the providers, whether it's entirely remote, whether it's partially remote, or anything like that. Will there be a deadline by which time we have to tell you guys which way we're going? because I know, like, at least for youth signing up for different sites, like, they're going to need to know that, right? Like, I know my program is definitely, like, if we are 100% remote, there are certain youth who, you know, won't want to be placed with us if that's the case.
Yeah, I should be careful not to speak for the youth programs. You know, my area of work and responsibility is with the adult programs. And yeah, that's pretty much what we're doing. We're working with all of our contracted providers to develop a kind of customized approach. You know, given the population that each provider is working with, and also considering guidance from the state that comes from above Partner for Work, how can we work this out so that when we reopen, we're doing all that we can, but staying safe at the same time. And that looks different in our work. That looks different at the Career Link than it does at the Earn sites, or it does with our transitional jobs programs or other community-based programs that we have. So it is a discussion, an ongoing discussion. So, but I should kind of defer to Mayada and her team with the youth programming on that.
I'd say you are absolutely foreshadowing the conversation that I anticipate having as a Learn and Earn team starting at 11, where for that, you know, we plan on really sharing out in terms of what we've uncovered and discovered and from the working groups, and what we've put together as recommendations for what we think might work this summer, knowing that the Learn and Earn committee is the group that has the final decision-making power over what we actually do. But I want to bring back some, you know, thoughts to everybody else. So I think what you're saying, what you're asking about is a good one. And I think, you know, one of the things we've definitely come to as a conclusion is what providers are able to do is absolutely, you know, dependent on what you feel like your capacity is and how you want to work that. So no matter what, there's going to be a next step of our team working individually with the summer providers to say, where do you think you stand? Like, what do you think you need? What can you do? Because I don't think that we're not going to be able to have, I don't think, one hard deadline that's going to work for everyone.
Yeah, a lot of this is really uncharted territory as well. I mean, we're watching announcements and developments from the governor, just as I'm sure all of you are. And despite our best efforts to plan locally, you know, we hear about those developments, whether they're from the governor or from Pennsylvania Labor and Industry or Pennsylvania DHS, that change how we're thinking and change the way we're planning. So I think we as a team are all going to have to deal with those developments together and adjust our plans accordingly. There's some good information popping up in the chat as well. So Lisa, I don't want to push you to share if you can't jump on and share some of what you're chatting about here, but I think there's probably some good information that Lisa is communicating in the chat room, if folks have access to that and want to look at that. But feel free, Lisa, to jump in and describe some of that. And, you know, we've got 10 minutes or so left. We don't have to use it all, but I definitely want to encourage other folks to jump in here.
Yeah, sure. I mean, just to mention some of the things in there, I mostly was talking at first about our plans to continue youth workforce programs this summer, but then in particular shifted to some of the safety things. We've been working with Allegheny County DHS to reopen a couple of our sites. One of them is ready to go for Monday. And just, you know, some best practices to keep in mind. It was certainly challenging to find some of these materials, but we were able to get access to the non-touch infrared thermometers. So it sounds like a lot, but I think we have to be safe. We are not letting any youth or staff into the building in the morning before the temperature is taken. And then we're also doing it at lunch and in the afternoon. We have a designated sick room that is completely cornered off on the other side of the building. we are using what's called an Everclean machine. So if you guys have never seen this before, Clorox sells a version of this. They're a little bit pricey to buy, but we think it's worth it. We'll be spraying down with the heavy duty cleaning every day, about 25,000 square foot of space in that building that's opening. And then staff ratios are going to be a lot smaller than the norm, mostly because of social distancing. And then we are providing all staff masks and gloves, and then the youth will have to wear masks as well. We have disposable masks to give to them. We don't normally have custodians there full time all day in this brick and mortar site, but they are going to be there all day cleaning high touch surfaces, doorknobs, light switches, things like that, bathroom sinks, all of that all day. So those are just some of the things that we're doing, and then fingers crossed, things start with Learn and Earn. That will probably be the site in particular, since it's really easy to access on the bus line and parking, where teen youth will be able to come and pick up blended learning materials, things like laptops, food resources, drop off their paperwork, etc.
That's really helpful, Lisa. And I just put a link to what I think is the Allegheny County DHS resource page for COVID-19. And, again, we promoted this earlier in the call, and I think we should promote it again. I think, as you've said, it sounds like you're working closely with them, Lisa. And in my observation so far, they've been really helpful and relevant. And I think to go and use some of their resource guides and some of their information, you don't have to be a contracted DHS provider. A lot of it is being made publicly available through their website. Another thing that we're thinking about on the CareerLink side, if we can plan this the right way, is trying to open up the centers to staff for a full week before the public, so that staff can get together, they can plan out the space, they can train, they can check all the supplies, they can go over the procedures and the protocols, and really get to the best of their ability as prepared as possible before actually inviting clients into the space. So if you have that ability, I think that could be a best practice too, just rehearsing what it's going to be like and making sure everything is in place before actually going live with participants again.
And I just want to say in our last couple of minutes that we should to some degree be able to pat ourselves on the back a little for being ahead in our thinking and planning. And so I hope what you don't take away from this conversation is that you are behind the ball in any way. You're really not, if this is something that you're just now starting to think about. And especially bravo to those of you who already have plans put in motion. That's really impressive. We've been doing some calls to cities just to get a sense of what they're doing with their youth employment programs for the summer, just to kind of benchmark our learn and ideas from what other folks are doing. And just, we are well ahead in our thinking and planning on all fronts, this one especially, when we've talked to other cities. And so I think to some degree we could cut ourselves a little bit of slack and be, be glad for us being able to sort of be ahead of this and thinking ahead, knowing that, the stay-at-home order still is in place now. It's been extended to May 8th. And so that's even a little more time to sort of think this through, so you can reopen your doors in a strategic and also like reasonable way for what you're able to do with your own capacity.
Great. So thanks to everybody for sharing. As we said earlier, we're collecting a lot of this and plan to share out with you some additional guidance. And some of that will be, I think, just referencing established guidance. As we said, we're definitely not experts in this. I find myself being asked to be an expert in a lot of things over the past 4 or 5 weeks that I'm definitely not qualified to be an expert in. And I'm sure all of you have been having that similar experience as well. So we just want to be in a position to share with you as much good information as we can. So we'll be working on that in the coming weeks. And before we kind of wrap it up here, is there anyone else, from Partner for Work or within the larger network that wants to add anything? Okay, thanks everybody. And of course, regarding any of this reopening stuff or other things that we talked about today, you know, if you're not really comfortable in this environment sharing your thoughts, just contact us later, and we'd be glad to walk through whatever questions you have. Thanks very much, everybody. Have a great day. Stay safe. We appreciate all the great work that you're doing.
Thanks, everyone. And if you're a learner and provider, please join us at 11 for the next Zoom call. Thank you.